Yes, good afternoon.
Good afternoon po, ma'am.
Good afternoon.
Good afternoon po, ma'am.
We kindly turn on your cameras, please. Pasensyahin ninyo ang ako ang kaitong. Na ako sa faculty una against the light siya, in fairness. Against the light si ma'am. So ano na lang. Please bear with the lighting. Okay. Sige. Okay, can I ask Miss Pansit Camille to please lead our prayer?
Father, Son, Holy Spirit, amen. Dear God, you help us to learn for today's discussion. Help us to learn more and guide us always. Amen.
Okay, thank you, Miss Pansit, for the prayer. Okay, can I just check the attendance first? Naapay wala nakatake og exam sa inyo, ha? Naapa? Si ano lang, si Miss Pansit, ato nakasaan na Miss Pansit sa COOR?
Thursday pa daw, ma'am. Kay busy pa daw sila.
Oo, kasi 'di ba merong accreditation ngayon, so dili pag ma-entertain sa COOR. Okay. My God. As in, ginayaga-yagaan yung ko sa panahon karon ba, dili naga-open ang ako ang mga tawag ani, ang ako ang mga discussion. My God, ang PowerPoint. Si Van ba kay lipay kaayo siya wala na abri ang ako ang mga ano, mga akong PowerPoint o ang akong Excel.
Recording in progress.
Okay, class, pasensya gyud kaayo ha. As in, please bear with me lang gyud kay tawag ani.
Recording
Ang
stopped.
signal sa school hinay kaayo. Aha. You know. Dili ko ka-open og PowerPoint, dili
Recording in progress. Recording stopped.
Okay. Good afternoon once again, class. Salamat sa pagsabot. Okay, na-open na gid nako sa wakas. Okay, so say present if you're here ha. Adin Cola, Christine,
Present po, ma'am.
okay. Ardel, Angela,
Present po, ma'am.
Rona Bien,
Present po, ma'am.
okay, Daniel Andrea,
Present po, ma'am.
John Bryle. John Bryle,
Present po, ma'am.
okay, Bryle, good. Christine Ann, Bertanya.
Present po, ma'am.
Cabriadas, Melanie. Melanie, nandyan na?
Present po, ma'am.
Okay, sige. And then, Kagampang Ivan.
Present, ma'am.
Okay. Stephanie Calyos.
Present po, ma'am.
Christine Concepcion.
Present po.
Faith Donaire.
Present, ma'am.
Gian Carlo.
Present po, ma'am.
Okay. Mary Grace.
Present, ma'am.
Okay. Van Allen.
Present po, ma'am.
Okay. Beatrice Librero.
Present po.
Cyril Maghanoy.
Present, ma'am.
Okay. May Marie Mangubat. Jiliary Morcia.
Present, ma'am.
Kayla Nimes.
Present po, ma'am.
Okay. Camille Pansit. Yes, you can have 2 devices. Walang problema. Okay. Zarine Paulino. Zarina?
Present po, ma'am.
Okay. Allen Papelera.
Present, ma'am.
Okay. Luis Placido.
Present po, ma'am.
Roan Razonable.
Present po, ma'am.
CJ Romano.
Good afternoon, ma'am. Present po.
Good afternoon. Julia Sab.
Present po, ma'am.
Okay. John Christopher Salido.
Present po, ma'am.
Okay. Gwen Dayan Salva.
Present po, ma'am.
Princess Aiko.
Present po.
Okay. John Romel Subing Subing.
Present, ma'am.
Bing, kompleto na gito kung pangalan sa imo ba? Diyan ko tubag.
Present po.
Okay. Next, Chantel Sukaldito.
Present po, ma'am.
Okay, siya. Crizel Tabsing. Crizel Tabsing. Wala si Miss Tabsing. Takuyan Earthzy.
Present po, ma'am.
Okay. Kayla Villodres.
Present po, ma'am.
Jessa Vinduan.
Present, ma'am.
Okay. And Jasmine Yap.
Present po, ma'am.
Okay. So, isa lang. Crizel. Okay. Lagyan ko lang ng absent.
Ma'am,
Yes.
di niyo po ako natawag. Sundungan po.
Ay, hala, sorry.
Present po.
Ay, hala, sorry, Norjen. Sorry. Thank you,
Okay
Norjen.
lang.
Naambakan. Sorry. Pasensya. Okay. So, kumusta ang inyong prelim exam? Hala, wala lagi sila. Speechless.
Nagkamang.
Sa man.
Nagkamang, ma'am.
Nagkamang? Mura po akong internet sa eskwelahan. Nagkamang?
Nagana, ma'am.
Man. Lisod ang exam. Di ba nagtudlo ko sa inyo ha? Or wala na mina? Charot. Ang sa man, Bing.
Lahutay raman, ma'am.
Nakalahutay ra. Okay. Actually, class, ang inyuha, di ba, wala ako nag-proctor sa inyuha. Kagagahapon ra na ako nakuha ang inyong Scantron paper, same sa PICA section. So, I still don't have your,
I-admit na ko si Kabiadas.
Si Bea, bagitubuan nag...
Recording in progress.
Lagi? Oh my God, Jesus. Tabang Lord.
Recording stopped.
Pasensyahin ninyo ang internet class ha. As in. Dili. O wala nakiuyon ang internet. Lang yun, unta tasudlon o kanang dili mo nato. Actually, kami ni Sir, Ed. Pero, oo. Ano ko, Lord, dangi, yun din tawon ko, Lord. Simba ko pala yun. Sana. Sing kanang kabalo gani kasi kanang grabe yun ang pagsulay sa ko akong adlaw ba. Isuport tigil nilang sumuga sa ako. Oh my God. Sige, class. Sorry sa internet. Sorry sa mga good afternoon. Wala po ako naka-exam. Okay. Next time na po. Okay, doon sa mga students na hindi pa naka-exam, okay, please inform the coordinator, but not today, but within this week, because you are given at least 10 days para mag-comply sa ating exam. Okay? So, yun siya. Maghatag na lang po ko list sa COOR sa inyong section sa katong mga wala pa naka-take og exam. Okay, so for now, we will just go over our new topic to discuss. Okay, we aligned our discussion today based on our syllabus. Okay, so supposed to be we will be discussing in continuation with antibiotics, but because of ASCO, we have to move forward. But hopefully by next week, we will continue with mga macrolides. Okay, just for today's discussion, we will be discussing about cardiovascular meds. Okay. So what is our objective for today's discussion? At the end of the lecture, you will be able to have an overview about the normal cardiovascular anatomy and physiology, to gain knowledge about the different medications to use, okay, in order to prevent certain cardiovascular related problems, be able to know the different uses of cardiovascular drugs, and to know the different medications, especially in the treatment of hypertension as one of the leading cardiovascular problems that we encounter, and to be able to gain knowledge with the health teachings and nursing consideration for nurses to perform and observe in every treatment. Okay? So let's discuss first what are the common medications that we use for cardiovascular diseases. So number one is our antihypertensive medications. So all of this will be discussed, but we will dwell more on for today's discussion about antihypertensive medications. So your antihypertensive medications, when we say of antihypertensive, automatic, ano na siya? That is the treatment that we use or medications that we use to treat for high blood pressure. Okay? So it seeks to prevent, antihypertensive medication seeks to prevent what? To prevent complications of high blood pressure such as your stroke and your myocardial infarction. Okay? So, ano yung mga medications under antihypertensive medications? We have your ACE inhibitors, your angiotensin II receptor blockers, your calcium channel blockers, your vasodilators, as well as your sympatholytics. Okay, yun yung mga common natin na mga ginagamit for antihypertensive medications. While diuretics, when we say of diuretics, when we talk about diuretics, These are also known as our water pills. Okay? Bakit siya water pills, ma'am? Because these medications are used or designed to what? To increase the amount of water and sodium that is expelled out of our body in the form of urine. Okay? So, pampabawas siya ng tubig at asin sa ating katawan kung sa sa layman's term. Okay? And they are commonly used for the treatment of high blood pressure. Okay? Not just high blood pressure, but also they are used for patients who have congestive heart failure as well as patients who have edema. Okay? So, ano yung ginagawa ng ating mga diuretics? Okay? They reduce the amount of fluid. Okay? Fluid in our blood vessels. And because of that, as a result, nagkakaroon tayo ng lower blood pressure. Okay? We also have medications such as anti-anginal. So when we say anti-anginal, okay, these medications are used to provide immediate relief from symptoms of anginal attacks, or to prevent a particular patient to have angina. So ano ba yung angina, ma'am? Okay, when we say of angina, it means your chest pain. Okay, this discomfort is usually experienced by a certain individual, okay, whose heart muscle lacks oxygenated blood. Okay, so nagkakaroon ng angina ang isang tao if they have insufficient oxygenation. Okay, and then we also have antiarrhythmic medication. Yung mga antiarrhythmic medications natin. These medications prevent what? Prevent and treat, okay, heart rhythm problems. For example, your patient is experiencing atrial fibrillation, atrial flutter, mga ventricular tachycardia, and ventricular fibrillation. Ma'am, unsa na siya, ma'am? All of these are what? Tinatawag nating mga heart rhythm problems. And how you will know about this later on in your advanced nursing, you will be taught how to read ECG tracing. And all of this, yung mga sinabi kong mga atrial fibrillation, mga ganyan, this can be noted in your ECG tracing. Okay? It could be by 12 leads ECG. Okay? Yung dikit-dikit sa heart, ay sa chest, yan siya. Okay? So, yung mga anti-arrhythmic drugs natin, okay, they also what? They try to correct, okay, the electrical system in our heart or in our cardiovascular, because it may be very quick or it could be very slow, or there are what? Inconsistency with the rhythm of your heartbeat. Okay? We also have what we call cardiac glycosides. Okay, what are these cardiac glycosides, ma'am? These are medications that are what? Commonly derived from foxglove plants. Okay, so mga herbal. Okay, herbal such as your digitalis. Okay, so the common cardiac glycosides that we are using is what we call digoxin. Okay, and this digoxin, okay, or digoxin is used, okay, to our patients for treatment of atrial fibrillation and atrial flutter. Okay, ma'am, di ba naka-mention ka kaganina katong mga tawag ani kaning ang atong antiarrhythmic is also a treatment for kanang atrial fibrillation and atrial flutter? Yes, because there are certain medications that we give together. Okay, kasi nga, di ba, if you can still remember during our introduction, I have discussed to you about medications that we can combine. Okay? Yun yung mga additives natin, mga additive medication na both sila, okay, same ng function, same ng effects, but we give them together to have a more efficient and effective effective result sa management ng ating patient. So, yun nga lang, not all patients can be administered in that way kasi nga we have to consider also yung mga pre-existing condition ng ating patient. For example, our patients has kidney problems. So hindi natin sila pwede bigyan ng higher dosage or mga multiple dose medications kasi we don't want to add on the existing problem of our patients. Okay? So cardiac glycosides can also be used for patients who have chronic heart failure. Okay, when other medications fail na to have a result or better output with our patients. Okay, we also have medications such as anticoagulants. What are these anticoagulants, ma'am? These are also known as our blood thinners. Ma'am, unsay pasabot sa blood thinners ang kanang ginapanipis ang dugo. Dili pud siya ingon anak ka literal ha. Okay, when we say of blood thinners, okay, what they actually do, these anticoagulants is they try to interrupt, okay, our body's normal clotting factor, 'di ba? For us normal individual, di ba pag mga samad ka, di ba magkaroon dayon siya mga kanang coagulation, di ba maglapot-lapot na yan ato ang dugo. So pasabot ana, okay, naturally we have our, okay, you may go to the CR. Okay. Naturally we have our own clotting process. Okay, kaya ma-stop na to ang mga bleeding na atay mga ma-prevent na to ang kanang signs o ay kanang possibility of having bleeding because our clotting factor is good. Okay, so with blood thinners, iyahang i-disrupt lang ang tawag ani ang normal na clotting factor nato para dili ta magkaroon og kanang mga thrombus formations. Okay. So we also have thrombolytics. Okay, what do you mean by thrombolytics, ma'am? These are medications used to dissolve a blood clot. For example, okay, a patient who has DVT, okay, deep vein thrombosis, naa na siya kanang clot, okay, sa ihang blood vessel. So, doctors will be prescribing the patient with what we call thrombolytics para malusaw ang blood clot and then dili na siya magpadayon o move towards kung asa man na siya. That could cause further complications to your patient. Pwede siya magkaroon o kanang blockage sa heart kasi with that, mamatay pa imong patient or kung dili man sa mga pulmonary veins or pulmonary arteries timon, diba? So we are giving these thrombolytics. And then we also have medications such as hemostatics. So ano yung mga hemostatics natin? Okay, sa hospital setting, ginahatag din nato siya for patients who are experiencing signs of bleeding. Okay? Yung ating aspirin, okay, yung ating aspirin that is considered as blood thinner. Okay? So, yun siya. Meron pa bang question? About sa difference between blood thinner and thrombolytics? Okay. Remember, your anticoagulants, iya lang palabnawon ba? Palabnawon lang niya ang ato ang mga dugo. Okay, para dili magkaroon og buo-buo. Ang thrombolytics naa naman siya pre-existing na kanang tawag ani kanang emboli na nay clot sa sulod sa imong blood vessel. So ang buhaton sa imong thrombolytics lusawon niya. Okay, para dili na siya magsabay sa blood flow, para dili siya magkaroon og complications pa. Okay? Mao na siya ang difference sa duha. Okay. So, did I answer the question? Wala naman ni-reply ang nag-question sa ako. Sige, i-message na lang po kung naapa kay further kanang queries. Kung nasabtan or wala. Okay? And hemostatic medications, okay, are medications that is given or is administered intravenously during emergency situation. That is to reduce possibility of hemorrhage because of ruptured blood vessels. Okay? Okay, para there will be, para dili na ta mag-abot sa point na it could cause death to our patients. Okay? So before we start, okay, I mean before we go on with our tawag nito, cardiovascular problem, let's first discuss the anatomy of your heart. Okay, just to refresh you with the anatomy of the heart. Okay, ang uban nakalimot na ani, okay? We all know that the anatomy of the heart, okay, the parts of our heart is composed of okay. Okay, so our heart is composed of large vessels such as your superior and inferior vena cava. We have also your pulmonary veins, okay, it's right and left pulmonary veins, your right atrium, okay, your pulmonary valves, your tricuspid valve, your inferior vena cava, your right ventricles, and then we have your aorta, your pulmonary arteries, okay, your left atrium, your mitral valves, your aortic valve, and your left ventricle. So this is the anatomy of your heart. Okay, I assume that you all know about this since you already finished your anatomy. But okay, just to continue about it, okay. So we all know that our heart has separate pumps. We have your right and left separate pumps, but it is and it has 4 chambers. Okay, it has 4 chambers because we have your right and left. Okay, right and left atrium or atria, which is our receiving chambers. And we have our right and left ventricles, which are your discharging chambers. Okay. So, after having a brief, okay, discussion about the anatomy of your heart, do you still remember how does your blood circulation flow? Meron pa bang idea? Sige, kaya para dili lang si ma'am ang sige istorya. Sige. I will ask Grace. Grace?
Pwede ka nang mag-shortcut lang, ma'am.
Oh, sige.
Magsulod ang blood, ma'am, paadto sa right atrium, gikan siya sa lawas. Tapos,
Before siya sa right atrium, asa man na mag-agi ang imuhang blood?
gikan siya sa body, ma'am. Tapos, dito siya musulod paadto sa heart, sa right atrium.
Body talaga yan galing. Kumbaga sa sa system. O, asa man siya. Bago siya makasulod sa imong right atrium, asa pa man una ag-agi ang imuhang tawag ani blood pasulod sa heart?
Dali lagi ko kabalo. Call a friend.
Call a friend. Call a friend. Okay. Naay nag-answer. Sige. Naay nag-answer pa sa imuha, Grace.
Ay, sa superior vena cava.
Saan? Sa?
Superior vena cava.
Okay. Our blood goes inside our heart from your inferior and superior vena cava. Okay? And then, from there, okay, Christine. Thank you, Grace. Okay, Christine. Christine Ann Bretanya.
Po, ma'am.
Okay. Once your blood is already inside your superior and inferior vena cava, where does it go?
Yung sa right atrium po, ma'am.
Okay, very good. Because remember, your atrium serves as what? Ano nga yung sabi ko kanina? Your right atrium serves as your unsang klaseng chamber?
Receiving chambers po.
Very good. Okay, very good. It's your receiving chamber. So from inferior and superior vena cava, your right atrium will be receiving the blood from the system. And it will pass through where? What do you call? That door. Diba? Kanang murag door na opening para mag-pass ang imuhang ano.
Tricuspid valve po.
Okay, very good. That is your tricuspid valve. Okay? So, Faith. Faith?
Yes, ma'am.
Okay. Sabi ni Christine, okay? Your blood from the system will pass on your tricuspid valve. From there, where it will go?
Kasi question, ma'am. Nalibot. Wrong, ma'am.
Ma'am. Ay.
Sabi na ko pa sa ano, ma'am.
Faith, paki-discuss daw sa circulation. Charot.
So, madam, isa may gulat yung mga sikuan.
Wala pa si ma'am, no?
Recording in progress.
Wala. Okay, class, sorry kay na ano.
Recording
Na,
stopped.
na-drop na po si ma'am. Okay. Ma'am, uy, undangan na lang ni nato. Ma'am, sige na makagka-drop, ma'am. Charot. Okay, sige. Saan na tayo nun? Faith?
Yes, ma'am. Wala na po nakalala ng mga tanong, ma'am. Tapos nawala po tayo sa mga.
Okay, sige. Pasensya lang. Okay. So, nakapasok na daw sa tricuspid valve yung ating blood from the system. So, saan na yan papunta ngayon? Hello, Faith?
Yes, ma'am. Ma'am. Ipapag na. Pulmonary valve, ma'am.
Pulmonary valve? As in, pulmonary valve. Tingnan nyo daw
Right
ang
ventricle, then
right ventricle dayon. Right ventricle. Okay. Right ventricle. And then from there, asan man magpunta? Try to look at the picture that I have that is in front of you. Okay? 'Di ba? Nakapas na tayo sa tricuspid valve. It's already in your right ventricle. And your right ventricle is what? What does it do? Faith? Ano gani ang mga ventricles natin? What did they do?
Thank you, sir, ma'am.
Okay, sige. But anyway, thank you, Faith. Okay, for trying. Okay, Stephanie.
Yes, ma'am.
Okay, Stephanie, in continuation to what Faith said, okay, your blood is now in your right ventricle. What will your right ventricle do?
Ano po, i-pump out niya yung blood papunta sa pulmonary semilunar valve po.
Very good. Okay. And what does our ventricles do? They are what kind of chambers? Diba? Kung ang ating atrium or our atria are receiving chambers, ano naman yung ating ventricles? Ha, iingon ko na kaganina, nakalimot ma'am, na-amnesia padali ma'am. Okay, sige. May nag-answer si Daniel. It's a discharging. Okay, remember it is a discharging chamber. Okay, that's why it is capable to what? To pump out your blood. Okay? Kasi nga, di ba, pagpasok niya, paano yan mag-transfer doon sa next phase, papunta sa lungs for ano, for gas exchange. Kung hindi ang ating ventricles ang mag-pump, di ba? It's always the atrium that receives and your ventricles will pump it out and deliver it to saan ba yun siya papunta. Okay? Okay, thank you, Stephanie. Next. Sige, para natin interaction, delete ang mga tulog. Okay, Norjen. Okay, wala ba yan ka natawag ka ganina, Jen? Sige. Si Ma'am, uy, may pagitawag na lang ko ni mo, Ma'am. Na lang ko ni istorya. Okay, sige. From your pulmonary semilunar valve. Okay. Asa na yan papunta ngayon ang iyong blood? Sige, tingnan niyo sa ano, refresh yourselves about your anatomy. Okay, sa blood circulation. Asa naman na padulong? Sige, Jen. Any idea?
Sa pulmonary arteries po, ma'am.
It will go to your pulmonary arteries.
Arteries.
Okay? So, mapunta mo na yan siya sa ating pulmonary trunk. Okay? This is your pulmonary trunk. And then from your pulmonary trunk, we have our right and left. Okay? Our right and left pulmonary arteries. Okay? Kasi, diba, dalawa ang lungs natin. So, what happens there? From your pulmonary arteries, saan napapunta ngayon yung blood?
Sa lungs, ma'am.
Norjen?
Papunta na po siya sa pulmonary veins.
Pulmonary veins kaagad?
Ay, okay.
Saan?
Right naman.
Hindi pa siya pulmonary veins. Tingnan nyo ha. Di ba, nagdaan na siya sa inyong pulmonary trunk. Nagpunta siya sa left and right pulmonary arteries. Ano ang nasa likod ng inyong heart? What is the posterior part of your ano? Ano ang nasa posterior part ng inyong heart?
Lungs na daw, ma'am.
Very good. Lungs. Nakalimot naman siguro ni ako mga estudyante og anatomy. Uy, my God. Okay. So, it will go to your lungs. So, what will happen in the lungs? Okay, thank you, Jen. Sige, Jen, kaya marag na-stress na ka. Charot lang. Okay. Sige. Jessa. Jessa?
Ay, ma'am.
Okay. Jess. Okay, di ba? Nag-adto na siya sa imuhang left and right pulmonary arteries. And then, dito na siya sa lungs. So, unsay mahitabo pag naa na sa lungs ang dugo?
Maano tong carbon dioxide, ma'am, then mag-gain siya of oxygen, tapos maato sa pulmonary, capillaries po.
Okay. Sige. Tama na to siya. Pero what is the exact thing that happens in your lungs? There is what you call pulmonary circulation. And in your pulmonary circulation, the exchange of gases takes place. Okay? Wherein your unoxygenated blood, okay, remember those blood that you receive from your right atrium going to your lungs are unoxygenated blood. Okay? Yung dyan na ninyo kalimutin class kay hantod sa imo mong nurse class, kailangan kabalo mo ani. Okay? Kay unsaon ninyo pagkabalo unsay kanang tawag ani etiology sa mga disease process sa cardiovascular, dili mo kabalo sa ingon ani. Okay? So, your tawag ani kanang the exchange of gases takes place in your lungs, specifically where in your lungs. Specifically where? What particular part of your artery?
Ma'am,
What part in particular sa lungs nag-exchange ang atong gases?
Pulmonary arteries.
No? Asan?
Capillaries, ma'am.
No?
Alveoli, ma'am.
Alveoli. Very good. Okay, thank you kay Julia, kay Allen, and kay nag-message sila. Okay. So the exchange of gases takes place in your alveoli. Okay? So from your alveoli, na oxygenated na imong blood, it will go back now to your pulmonary veins. Okay? Kung tanawon ninyo, okay, diba? Kaning mga red color na mga pasabot ani, ang naana ni ang muagi na diri is already oxygenated blood. Okay? So it will now go to your pulmonary veins. And then it will what? It will be received again to your asaroan.
pag ika na sa ma'am, pulmonary vein.
From pulmonary veins, asa na siya padulong ang blood?
Ma'am, blood and mag-ato siya sa left atrium. And
Very
then
good.
Sa,
And then
sa mitral or AV valve or the mitral into the left ventricle.
aspaso ini ambak man dayon.
Ay, sorry.
Ambak man yun. Tama yun. That is, it will be received, okay, the oxygenated blood will be received by your left atrium and it will pass on your bicuspid valve. Okay? And then from there, okay, it will be received by your, okay, it will be received and will be pumped again by your left ventricle towards your aortic semilunar valve, and then it will pass through the aorta, and then it will be on your systemic circulation. Pag systemic circulation, balik na po ta sa inferior and superior vena cava, and then so on and so forth. Okay? Class, ayaw, intawin ninyo kalimti ang inyong blood circulation, ha? Okay? So, sige. Ma'am, kanang tinuod, ma'am, nag-unsa ta, ma'am, nag-anatomy ta o nag-pharma? Diba? Marang nakalimot po, ma'am, unsa na ato ang subject karon, ma'am? Okay? So, let's discuss first what is blood pressure. Kasi nga, our topic will more dwell today on hypertension. Okay, so when we say of blood pressure, this is the blood pressure that moves the blood through your circulatory system. Okay, and when we say of blood pressure, this is the amount or the measurement of force that is applied on your arterial walls. Okay, that is what blood pressure is. So ngano daw important ang ato ang blood pressure? Okay, this blood pressure is important, or the force of our blood pressure is important because the oxygen and the nutrients, okay, that this blood is carrying will not be pushed around your circulatory system kung walay pressure ang imuhang dugo. Okay, kung mura na pod good na og kanang 'di ba, kung ang tubig kay kanang walay pressure, 'di ba kanang ano lang siya, flowing lang siya straight. Murag muagi lang siya. But if it has pressure, okay, there will be kanang tawag ani kanang murag may emphasis ba na o dapat masulod ka, dapat ma-receive nimo. Ana na siya basta blood pressure, okay? Para there is what assurance that the necessary nourishment or the necessary oxygen that is needed by our tissues and cells will be delivered, okay, because of that pressure. And then maliban pa sa kanang tawagan kanang nutrients and oxygen, okay, it also delivers white blood cells that act as our antibodies in the body that will serve for our immunity, as well as hormones, okay, necessary for bodily function, including your insulin. Okay? So, asan daw or ano daw, what causes, okay, what causes the exertion of pressure in our arteries? Okay? It is from our heart because our heart is the one that creates pressure, okay, by forcing out blood when it contracts every time it beats. Okay? So, there are actually 5 determinants, okay, or 5 factors that influence our blood pressure. But here we only give emphasis on 2 things, okay, but it's actually 5 factors that influence the changes in our blood pressure. Okay, so what are these 5 factors now? We have our cardiac output, our peripheral vascular resistance. We also have our volume of circulating blood. We also have what? Viscosity of the blood and the elasticity of our vessel walls. So those are the 5 things, okay, that influence our blood pressure. Okay? But I specified only 2 determinants of our blood pressure, which is your cardiac output and peripheral vascular resistance. So what is cardiac output? Okay, Christine, Concepcion.
Hello, ma'am.
Yes, Christine. Yes, team. Okay. Give us an idea about what is cardiac output.
Marinig po ako.
Yes po, marinig po kita.
Yan po yung amount ng blood po na gina-pump ng heart per minute po.
Okay. Specifically where? Jilia. Thank you, Tin. Okay. Jilia.
Ma'am,
It is the volume of what? Sabi ni Christine, it is the volume of blood. Or it is the, ano yun, Tin? Yung ano ng heart natin. Okay, may nag-answer
amount
din
po.
dito. Sige. Ano yun, Jill?
ang question, ang sakit ang question, ma'am. Bale,
What is
kung
cardiac
kaya,
output?
ang cardiac output kay di ba mo man ang product sa heart rate o katong sa atong stroke volume.
Okay, sige. Sige, Jill. Thank you. May answer dito. May nag-chat. Thank you kay thank you kay kay Daniel, kay Van, and kay Jasmine. Okay, and then Grace also answered here. Your cardiac output is the product of heart rate and stroke volume that is measured in liters per minute. Correct. That is the exact definition of what your cardiac output is. Okay, and then how are you going to compute for your cardiac output? You are going to compute it by multiplying your stroke volume, okay, with your heart rate, and that will be your cardiac output. Okay? So, ano daw yung factors that affects, okay, the increase and decrease of your cardiac output? Okay, since we're talking about the cardiac output. Okay, the factors that affect, okay, causes increase in your cardiac output is your sympathetic stimulation. Okay, catecholamines, okay, such as your epinephrine and norepinephrine, your thyroid hormones, and there is an increase in your calcium ion levels. Okay, those are the reasons why your cardiac output is increasing. Again, caused by sympathetic stimulation, your catecholamines, your epinephrine, norepinephrine, your thyroid hormones, and increase in calcium ion levels. Those are the reasons why your cardiac output is increasing. Okay? And then, if merong reason why it is increasing, of course, there is a reason why it decreases. So, ano ang causes ng decrease of cardiac output? It could be caused by your parasympathetic stimulation. Okay? Kanina, sympathetic ang nagapa-increase. Ang nagapa-decrease is your parasympathetic stimulants. Okay? There must be an elevated or decreased potassium ion levels. Okay? Pwede mag-increase, pwede mag-decrease ang iyong potassium ion levels sa dugo. Okay? There is also decreased on calcium levels in your blood. And anoxia. Okay? Anoxia is the absence of O2 or oxygen in the blood. And we also have acidosis as a factor that decreases your cardiac output. Okay? So when we talk about peripheral vascular resistance, ano daw ang ibig sabihin ng peripheral vascular resistance? This means, or this particularly refers to the compliance. Okay? When you say compliance, it is the ability of a certain compartment to expand and accommodate to increase its content. Ma'am, pwede paki-elaborate, ma'am. Sige, elaborate natin. For example, tawag nito, a balloon. Okay, a balloon. Diba? Ang deflated balloon. Diba? Flat na siya. If you're going to blow air inside that balloon, what happens is, di ba mudako siya? The enlargement of that balloon is what you call the compliance. Okay? There is expansion, allowing the gas to be accommodated on that certain area or on that balloon, on the surface of the balloon. Okay? So that is what you call tawag nito,
Recording in progress.
Uy, class, pasensya, gid kaayo ha. Ang internet, gid diri sa
Recording
school, ang
stopped.
problema, class, ba, sa tinuod lang. Ay, Lord. Na-drop na pugod. Naunsa naman ni, uy, my God. Niya mo nilang ginaingon na dapat diri mag-lecture pag sure sila. Ay, oh my God. As in, may hugot. Ay, just... Okay. Sige. Nakabalik na. Okay. So, okay, the policy of compliance. Okay. Okay. Yes. Oo, balik si ma'am sa compliance. Okay. When we say of compliance, again, it is the ability. Okay. It is the ability of tawag ani, asa naman ko ba? Nawala ko. Tama ni. Okay. When we say of compliance in your peripheral vascular resistance, okay, 'di ba? Yun yung 'di ba sa balloon, 'di ba? Pag mag-inflate ka sa balloon from a empty, okay, kanang flat pa siya. Okay, wala pa siya hangin. Diba, pag bugahanin mo siya, mudako siya, expand. That is to accommodate more air para magsulod dito sa balloon. Same ra na siya sa inyong veins. Okay? Same po na siya sa tong veins. As the pressure is getting higher, your veins is also expanding to allow what? More space. Okay, more space for blood surge in your vessels. Okay? So, mauna siya. Ikumpara ninyo diri sa ako ang sudlay nga maskin pag unsay bato nato wala tayong palaan niya kay fix na ang iyahang structure. Okay? Dili na siya mabag-o. And ma-change lang siya kung akong putlon, pero it will not give us space for expansion. Okay? So, yun yung tinatawag natin na compliance. Okay? Yung expansion. Okay? To accommodate more space para sa mga tawag nito sa blood. Okay? As it increases its pressure for blood surge. Okay? So between our vessel, between our veins and our arteries, okay? Like what I have said, it is the veins that is more vascular. Okay? I mean, your veins is more compliant compared to our arteries. So, kaya yan, ang ating veins is more capable to hold more amount of blood. Kaya bitaw, 'di ba? Pagsulod, 'di ba? Remember niyo usab, 'di ba? Ang atong atrium, they will only receive. And after that, it will be moved to your ventricles, and with your ventricles, because of its what? Its ability to comply. Okay? Its ability to comply and expand, ang blood na nasulod sa iya, capable niya i-release or i-push out. Okay? Para i-deliver kung asa man siya dapat. Could be to your lungs or going back to the system for oxygenation. Okay? That is what your veins are doing. Okay? Okay. So we will now go to our, so nasabtan ba ko sa ato ang compliance? Na may question? Kung wala, I will proceed now with our baroreceptors. Okay, so what are baroreceptors? Our baroreceptors, these are sensors that is located in our carotid sinuses and in our aortic arteries. Okay, so what these baroreceptors do? They are the one that senses the blood pressure. Okay, and they are the one that relays the information to our brain so that there will be proper blood pressure na maintenance. Okay, mo ano ng atong mga baroreceptors. Hey brain, nag-ano na ko, nag-send akong info sa imuha na naay tawag ani sufficiency or insufficiency sa ingon ani ana. So it is the task of the baroreceptors to signal, okay, the brain as to how our body or how our brain will compensate to the existing problem, okay, that our body is experiencing. So I will show you a video of how does baroreceptors do. So let me just continue with this renin angiotensin aldosterone system, or RAAS. So what is this ba? Okay, this RAAS, or renin angiotensin aldosterone system, this is primarily associated with the blood pressure regulation by modulation. Okay, by modulating our blood pressure or the blood volume by sodium reabsorption, potassium secretion, water reabsorption, as well as your vascular tone. Okay, and this RAAS, these are what? Being activated when there is a drop in our blood pressure. Okay, so ano ginagawa ng ating RAAS? They are the one stimulating to increase water and electrolyte reabsorption in our kidneys. Okay, as compensatory or compensation to the drop of blood volume in our body. Para balik tayo sa homeostasis na magkaroon tayo ng normal blood pressure. Okay? So, baroreceptors. Okay, so when we say again of baroreceptors, okay, the blood from your ventricles, it will pass on your aorta and carotid arteries. So it will be the one to signal the brain if there is sufficient and insufficient what? Blood volume. And the baroreceptors is going to signal the brain, and then there will be compensation. Okay, so anong nangyayari doon? Okay, watch this video.
Reflex, or baroreceptor reflex, is one of the mechanisms the body uses to maintain stable blood pressure levels, or homeostasis. Baroreflex is a rapid negative feedback loop in which an elevated blood pressure causes heart rate and hence blood pressure to decrease. Reversely, a decrease in blood pressure leads to an increased heart rate, returning blood pressure to normal levels. The reflex starts with specialized neurons called baroreceptors. These are stretch receptors located in the wall of the aortic arch and carotid. Increased blood pressure stretches the wall of the aorta and carotid arteries, causing baroreceptors to fire at a higher than normal rate. Laryngeal nerves to the nucleus of the tractus solitarius, the NTS, in the brainstem. In response to increased baroreceptor impulses, the NTS activates the parasympathetic system, the PSNS, and inhibits the sympathetic system, the SNS. As the PSNS and SNS have opposing effects on blood pressures, PSNS activation and SNS inhibition work together in the same direction to maximize blood pressure reduction. Parasympathetic stimulation decreases heart rate by releasing acetylcholine, which acts on the pacemaker cells of the SA node. Inhibition of the sympathetic division decreases heart rate, stroke volume, and at the same time causes vasodilation of blood vessels. Together, these events rapidly bring down blood pressure levels back to normal. When a person has a sudden drop in blood pressure, for example when standing up, the decreased blood pressure is sensed by baroreceptors as a decrease in tension. Baroreceptors fire at a lower than normal rate, and the information is again transmitted transmit the NTACs by inhibiting parasympathetic and activating sympathetic activities. The sympathetic system releases norepinephrine, which acts on the SA node to increase heart rate, on cardiac myocytes to increase stroke volume, and on smooth muscle cells of blood vessels to cause vasoconstriction. Together, these events rapidly bring up blood pressure levels back to normal. Baroreflex is a short-term response to sudden changes of blood pressure resulting from everyday activities and emotional states. If hypertension or hypotension persists for a long period of time, the baroreceptors will reset to the new normal levels. In hypertensive patients, for example, baroreflex mechanism is adjusted to a higher normal pressure and therefore maintains hypertension rather than suppresses it.
Okay, putol-putol daw ang video.
Yes po, ma'am.
Yes po, ma'am.
Ay, okay, sige. I-ano ko na lang din ito. I-share ko sa Kuiper. Okay? I-ano nyo na lang sa Kuiper. Pasensyahin na lang yun ninyo yung internet class. Sige. Pero masabtan pa man kaya ko ninyo. Madunggan man kaya ko.
Yes po, ma'am. Madunggan, ma'am.
Okay, ang video lang, Ana. Sige. Napa naman ko isa pa ka-video. Sige lang. Kung ano man, i-post ko na lang ito siya sa Kuiper para at least makita ninyo ng maayos yung video. Okay, so let's go to our RAAS. So what happens on your RAAS? Okay, your renin-angiotensin-aldosterone system or RAAS plays a very important role in the regulation of your blood volume and systemic vascular resistance. Okay, these two, the blood volume and your systemic vascular resistance, work together to influence the what? Your cardiac output as well as your arterial pressures. Okay. So there are three important factors or three important components of this RAAS. It is your renin, your angiotensin, and your aldosterone. Okay, those are the three important components of this system. Okay, your renin, is actually released or is primarily released by your kidneys. Okay, and they are being stimulated or they stimulate in the formation of your angiotensins in our blood and tissues, which later on will stimulate the release of aldosterone in your adrenal cortex. Okay. So our renin is a type of proteolytic. Okay, it's a type of a proteolytic enzyme that is released in your circulation from the kidneys. Okay, tapos its release, the release of this renin is stimulated by what? Number one, your sympathetic nerve activation. Okay, renin is being released and is stimulated by sympathetic nerve activation. Second is the renal artery hypotension. Okay, this could be caused by systemic hypotension or renal artery stenosis. Kaya nagkakaroon din tayo ng release ng renin. Or it could be by decreased sodium delivery, okay, to the distal tubules of your kidney. Kaya nagkakaroon siya. Yun yung mga tatlong factors ng release of renin. Okay? So, here on the diagram, it shows here that once there is decreased blood pressure or decreased oxygen in the blood, your JG, okay, your JG cells in the kidney will be releasing that renin. Okay? So, this renin will be stimulated by your angiotensinogen, which can be found on your liver. Okay? And then, as a result, these angiotensinogens will be releasing angiotensin 1. Okay? And Because of that, our ACE or acetylcholine enzymes will be stimulated, and it will now cause the production or the stimulation of your angiotensin 2. Ma'am, unsa man ni siyang angiotensin 2? Our angiotensin 2 is a very potent, It's a very potent, what is this? Kanang vasoconstrictor. Okay? It's a potent vasoconstrictor. So, yung ating angiotensin, if there is now release, okay, or kanang production of or conversion of angiotensin to, two things happen. Okay? Ano yon? First, yung sa letter A natin. Because of intense vasoconstriction, there will be an increase in your peripheral resistance, and as a result, your blood pressure will be increased, and the blood pressure or the blood flow will be restored. Okay? So now your kidneys will be decreasing the production of your renin, because remember, your renin is being produced, okay, in your kidneys. Okay, so the other thing that happens is, okay, in your adrenal cortex, okay, diba? Your adrenal cortex is the one that produces your aldosterone, okay, in the nephrons. So it will what? It will absorb water and sodium retention. Instead na i-excrete niya, iyahang i-hold. Okay? Iyang i-hold ang excretion sa sodium and water sa ato ang lawas. Okay? And then the sodium-rich blood now will be magkaroon og signal ang atong hypothalamus. Okay? Na okay, na ano siya, enough na ang ato ang sodium o ato ang water. Pwede na tamag karoon og elevated na blood flow karon. Okay, or there will be now increase in the blood pressure. Kasi nga na-hold na, 'di ba? Remember where if salt, pagdaghan ang salt, mas prone ta sa tawag ani water follows, 'di ba? Where salt goes, water follows. So if there is now retention of water and sodium, okay, mag-increase yun ang ato ang blood flow or ang ato ang blood pressure. Okay? And then there will be what? Your antidiuretic hormones will be stimulated na dili na lagi siya mag-overproduce. Okay? Or dili siya mag-produce kay para mag-continue og increase ang imuhang BP to correct, okay, to correct the existing problem in your body. Okay? As part of the negative feedback system or compensatory mechanism of our body. Okay, this is what happens. So, naapog ko'y video, unta mo play siya o dili siya mag-lag. So, this is what happens in your RAAS.
Renin-angiotensin-aldosterone system. The renin-angiotensin-aldosterone system is a classic endocrine system that helps to regulate long-term blood pressure and extracellular volume in the body. The system begins with the release of angiotensinogen into circulation by the liver. This may be in response to low blood pressure and adverse changes in sodium concentrations. An enzyme, renin, is secreted, which cleaves angiotensinogen to form the inactive decapeptide angiotensin 1. Further transformation of angiotensin is carried out by angiotensin-converting enzyme, or ACE. This is predominantly found in the pulmonary circulation. However, ACE is also produced in the vascular endothelium of many tissues, including the kidney, adrenal gland, brain, and heart. The angiotensin-converting enzyme converts the inactive precursor angiotensin 1 into the vasoactive peptide angiotensin 2. In addition, alternative pathways exist that do not rely on either renin or ACE. In non-renin pathways, enzymes like tonin and cathepsin D release angiotensin 1 from angiotensinogen and tissue plasminogen activator, or TPA, and can make angiotensin 2 directly from angiotensinogen. This bypasses the midway production of angiotensin 1. Enzymes like kinase can form angiotensin 2 from angiotensin 1 via an ACE-independent pathway. Angiotensin converting enzyme also degrades bradykinin, which is required for synthesis of a major vasodilator, nitric oxide. Angiotensin 2 binds AT1 receptors expressed on the surface of vascular endothelium and hinders nitric oxide synthesis as well. Reduced bioavailability of nitric oxide combined with the stimulation of AT1 receptors on smooth muscle cells causes vasoconstriction. In addition to a vasoconstriction effect, stimulation of AT1 receptor causes the adrenal glands to release the hormone aldosterone, resulting in sodium retention. Combined with vasoconstriction, this increases blood pressure. In the final stages of REX, the kidney reduces the production of renin. Most of the known actions of angiotensin 2 are mediated through the AT1 receptors, which can be found in the kidney, heart, vascular smooth muscle cells, brain, adrenal glands, platelets, adipocytes, and the placenta. Angiotensin 2 type 2 receptors can be found in low levels mainly in the uterus, adrenal, central nervous system, heart, and kidney. AT2 receptors appear to counteract the effects of AT1 receptor stimulation. Another angiotensin 2 type receptor is the AT4 receptor. Its stimulation may increase synthesis of the natural inhibitor of TPA called I1, thereby reducing effective fibrinolysis. Stimulation of AT4 receptor appears also to promote cell growth and proliferation.
Okay. Okay ba ang video or i-post gihapon ako? Hello, at nawala na akong estudyante.
Post
Nakong
lang
dira.
po, ma'am.
Post pa rin, ma'am.
Ha?
Okay lang, ma'am, pero pwede i-post na lang gihapon, ma'am.
I-post na lang gihapon. Okay, sige. Okay, sige. Ako rin ang sa Kuiper. So, hypertension. So, let's go now on the hypertension. Okay. So, when we talk about hypertension, okay, this is the one of the leading, okay, cardiovascular diseases that we really encounter. Okay, and hypertensions are known to be silent killer. Okay, kasi nga, mostly of these people don't know that they have already hypertension because some of us, because this hypertension is actually asymptomatic. Dini siya parehas sa ubang sakit nga natay bation. Okay, we will only know that we are hypertensive once we will have our self-check. Okay, so this high blood or high blood pressure can lead, humans or individuals serious problem, okay, including what? Your heart attack, heart failure, and your stroke. And pinaka-worst, pwede siya mag-cause of death sa ato ang mga patients. Okay? So, there are two kinds of our hypertension. We have our primary and secondary hypertension. So, what is this primary daw? Our primary is also known as our idiopathic. Okay, idiopathic hypertension. So, what are these idiopathic or primary hypertension? These are hypertension or these are abnormal high blood pressures that is a result, that is not a result of a certain medical condition. Okay, example of that is because of obesity. Oh, igo si ma'am. Pero actually normal pa man akong blood pressure. Okay? Isa ka factor nga no nagkakaroon ng primary or idiopathic hypertension is because of obesity. Okay? It could also be what? Family history related, and because of our unhealthy diets. Okay, those are the reasons why we have or why we acquire this essential or idiopathic hypertension. Okay, and actually this kind of hypertension, this primary, is reversible or could be treated. Okay, for as long as there will be, by sir, ingat. Okay, for as long as there will be what? Compliance to medications, as well as what? Lifestyle modification. So those are the key rules or the key things that we have to do to reverse those idiopathic or essential hypertensions. Okay, while our secondary high blood pressures, okay, these are high blood pressures related to a certain medical condition. Okay, this condition could be related to what? To a kidney problem or arterial problem, heart or endocrine problem. Okay, yun yung mga factors bakit nagkakaroon. Malay nimo na atherosclerosis imong patient. Ang imong patient is na ay tawagan ka ng kidney problem like chronic renal failure. Okay, so expected yun mo pag ingon ana imong mga pasyente, imong BP kay tig 180, tig 190, okay? Tapos pregnancy, okay? Pregnancy can also be a reason or a factor bakit nagkakaroon tayo ng secondary blood pressure. Okay? So, merong iba na after they deliver, mag-normalize sila ilang blood pressure. But there are also other people na magtuloy-tuloy na gyud na siya. So after they gave birth, okay, they will be given maintenance medication para na magkaroon of what? Further complications with regards to hypertension. Okay? So what are the important health teachings that you have to educate, okay, your patients, okay, if they are having hypertension? Number one, or remember the mnemonics pressure. Unsay pasabot anak ma? Pressure. Number one or letter P stands for blood pressure monitoring. Okay? Because like what I have told you, unlike all other cardiovascular diseases, our hypertension is asymptomatic. We'll only know this once we will have our what? Our self-check or monitored for our blood pressure. Okay? So, it's really important, especially for us na medyo naanata sa mga medyo aging na ta. Okay? Medyo aging na ta. So, we really have to give importance as to monitoring of our BP. Okay? So, kung naay mga elderlies dira sa atua niya, tawagan ka ng, uy ga, ano ko ga, check akong BP ga, do not hesitate. Okay? Do not hesitate to extend help to those people. Really, it's a big help. Okay? Para nila if their blood pressures are still in normal range or is it elevated or mubo. Okay? So next, R, rise slowly. Ma'am, ngano kailangan mag-rise slowly, ma'am? Okay? We don't want to have orthostatic hypotension. Okay? Paunsa ta magkaroon og orthostatic hypotension? Pansin ba na ninyo, class ining? Higda mo, no? Unya, ganing kabalo mo nga naamoy buti, naamoy RLE, unya inyong RLE kay dapat inyong circle 6:45, unya na mata ka og 6:30 kana mo ambak ra kag kalit sa imong higdaanan nga mura na kag ding ang bato si Darna ay ulon lupad na lang kag San Pedro, okay, di ba? Unsay feeling nimo ana, di ba? Bangon nimo, di ba, kana murag lipong-lipong pa ka, because that is orthostatic hypotension. Okay, that's why after, di ba, ang advice dito sa tuwa, after when we wake up and then we rise, Okay? We have to do it slowly. Slowly in a way na nag-block ang pananaw kadali. Tinuod yun na in. Tinuod yun na. Kana ganing murag, asa na ko, pwede ma-amnesia kadali. Ana, dayon. Amnesia, di ay ito nadubayan raong mata. Okay? Tapos wala na. Kanang, nagmubo na day ang imuhang blood pressure. Okay? So, tawag ani kanang, what is advised for us to do is when we rise up from bed, we have to move on lateral. Okay, magtagilid usa ka. Pagkatapos, you will try to dangle first your leg. Okay? Dangle your legs and then try to push yourself up. Okay? Try to push yourself up. That is the proper way to stand up in order for you not to have orthostatic hypotension. Okay? Especially sa mga elderly nato, we have to really teach this. Kasi nga, di ba, kapag ang elderly nato, mga tumba, they are prone to what? Injury. Dili lang ang elderly, maskin kita. Okay? So, muna siya ang dapat buhat. And then, what else? Para po ma-prevent nato ang atoang mga lower back pains. Maubitaw na, di ba, pansino ninyo kita kay prone kaayo ta sa lower back pain because of kanang pinakalitra o bangon. Gikan paghigda, bubangon o galit. It will strain your lower back muscles. Okay? Then, letter E, eating must be considered. Honestly, class, lami man jud mo kaon. Halata man sa imo, ma'am, kay perting imong lingina, ma'am, imuhang aping mura nagmubuto. Grabe ka, pasagdahin na ninyo kung aping, okay? Pasagdahin na ninyo kung aping kay anak ang Chinese, paglingin daw ugnaw kay kwarta daw, pero kubre ra man gyapon si ma'am. Okay? Pero di ba? Signs of ang ano na lang ana ang tawag ani kanang pampalubag loob kay paglingin ugnaw, pasabot ana healthy. Healthy nga taba ra di ay pero sige. Okay, going back. So eating must be considered. Eat in what way? Okay, it's okay to eat. Okay, there's no problem. Do not deprive yourself of eating the things that you want. But for as long as there should be what? There should be regulation. And there should be modulation. Okay, there is regulation and modulation of everything that you eat. Kasi nga, everything in excess or everything in too much is really harmful. Dili lang sa ato, but in our health per se. Okay? Okay. And then, staying on medication. Okay. Staying on medication is a big factor in the treatment of our mga, not just with hypertension, but even sa to ang mga antibiotics, di ba? I always give emphasis on the compliance of your patients with regards to the treatment remedy. Kasi nga, we don't want them to have resistance. Okay? And skipping or stopping, same lang po na siya sa staying on medication. We really have, if muingon na ganit siya nga maintenance, dili kay kung normal lang imong BP, dili na pod ka mo inom kay na ano naman na reach naman ang normal na nga range sa BP, dili ingon ana. When we say it is a maintenance, it will be maintained or it will be taken by you or by your patients until the last breath. Okay? Until their last breath. Kaya syempre, maintenance, forever na siya. Okay? Mauna na siya iyang imnon hantod sa hantod para ma-prolong ang iyang life and then para dili magkaroon of further complications. Okay? And then U stands for undesirable responses. So, unsa man pasabot ani, once your patient is experiencing side effects, especially if it is adverse effects of those medications, what you have to do, you have to inform them to directly go to their attending physicians and have their medications evaluated. Okay? Evaluated, dili kay i-check ni doc kung ay panus na imuhang tambal ma'am, expired na di mauna na ingon ani, dili. Okay? Para i-check ni doc kung ang imuhang medicine is subject for change or regulation lang of dose. Okay? R stands for remind to exercise and decrease alcohol intake. Okay, to exercise. Class, kanigid siya no mas sa ato agyod lisod gyud kay ni nga buhatonon kanang mag-exercise. Di ba? Kanang murag sa inyo ha palang daan, ma'am, daghan na kay kong studyhan, ma'am, mag-exercise pa ko, ma'am, asa pa man na ko, ano ma'am, uy, asa ko pa man na ba ibutang, ma'am. Okay. Simple walking class is a big help already to our body. Ikaw daw ma'am, paglakaw daw ma'am, ayun lang ko ninyo labota. Okay na, may exception to the rule. Okay? So kamo na lang pag-exercise. Nyari mo, adto mo din sa eskwelahan no niya. Parehas tong exam. O, di ba? Katong exam yun. Ang exam, daghan kaayog tao. Pagkahuman, asa man, tanan man na kayo og elevator. Kay unsaon dili gusto magbaktas sa hagdan. So ana palagi ko, oh, my God, kung kaya na ko mubaktas man ko ba? Aliman ka na late ko sa kung exam tong tawag ani proctorship na ko tong miagi kay ka oras ko sa elevator. O di ba? So exercise. Mura po ni mo ginaingon, ma'am, ba? Di nilang mo gamit og elevator kay unahon ka na. Mura siya, pero joke yung niya inyuhang klase no kay naa diri sa mga 11th floor, anak gani niya gikan ground floor. Pag abot nimo dito sa 11th floor, matingala na lang ka imuhang dila na ana sa ubos. Okay, joke lang. Okay, sige. So, decrease in alcohol intake because ano man, we all know that alcohol increases the blood levels of your hormone renin. Okay? That will cause what? Will cause blood vessels to constrict, and then as a result, it will shoot up your blood pressures. Okay? So, kung hypertensive na ka, inom pa ka og alcohol, diba? Musamot og kataas imong BP. Una, ang ano jud ara, unsa man jud makuha nimo anang tawag ani, uy, anang alcohol, maura pod na siya sa smoking. Okay? Kaning smoking o alcohol, makapataas gyud ni siya BP because it will what? It will narrow the blood vessels. And then maliban pa sa makuha nimo ana ng hypertension, mag-hypertension pud ka kay wa na kay kwarta. Okay, kay nahurot na og ginasto sa imuhang bisyo og inom og sinigarilyo. Okay? So wala jud kay maayong makuhaan ng inom-inom og panigarilyo. So you really have to educate your patients as to the importance of these health teachings with regards to the treatment of hypertension. Now let's proceed with your angiotensin converting enzymes or your ACE inhibitors. These medications usually kanang naana siya mga pril sa tumoy. Okay, so ano daw ang inhibitors? Okay, they block the conversion of angiotensin 1 to angiotensin 2. Okay, remember your angiotensin 2 is a potent vasoconstrictor. So with your angiotensin 2 forming. Oh my God, unstable na po ng internet. Okay, so ano daw ang use ng ating mga ACE inhibitors? These are used for the treatment of hypertension as well as myocardial infarction. Okay, and these ACE inhibitors, they are what? They are the drug of choice for our patients experiencing chronic kidney diseases and congestive heart failure. Okay, So, ay ma'am, choppy. Oh my God, choppy. Choppy gihapon. Oh my God. Internet tabang. Okay, again, your ACE inhibitors. Nagalag ko, OMG. Sige, o, sabon ako ha. Madunggan ko. Thumbs up daw, Bi, kung madunggan pa ko. Hala. Okay, nag-thumbs up. Okay, sige. ACE inhibitor angiotensin 2, which is a potent vasoconstrictor. Okay, so these medications are used, okay, primarily in the treatment of hypertension and medyo choppy naman ulit. Saan ko maniwi? Sige. Pero madunggan ko karon.
Madunggan man, ma'am.
Okay, sige. Okay ha? Ano lang, i-call lang ako attention inig mag-choppy kay usabon ako. Okay? So, again, these medications, these ACE inhibitors are used for treatment of hypertension and myocardial infarction. Okay? And these ACE inhibitors are the drug of choices as well for patients who are experiencing chronic kidney diseases as well as congestive heart failure. Okay? And then like what I have said, ACE inhibitors kanitong mga pril. So we have your benezapril as one of our medications, and the most common, okay, na ma-encounter yun nato, mas inasa, we have our captopril, or ang iyang branding is Capoten. Okay, we have enalapril, we have kinapril, fosinopril, okay, and so on and so forth, kanitanan. These are examples of your ACE inhibitors, okay? So what are the side effects of these ACE inhibitors? Okay, it is common for our patients to experience cough, hypotension, headache, dysgeusia, or the first kanang tawag-ani kanang metal-like taste sa ato ang patient every time they are taking this ACE inhibitors. They also, some of them also experience insomnia, nausea and vomiting, as well as diarrhea. Okay, but what is more threatening is if our patients will be experiencing these adverse effects, especially this reflex tachycardia and angioedema. Unsa ning reflex tachycardia, ma'am? Okay, reflex tachycardia is if our blood pressure decreases, okay, the heart beats faster in a compensation to raise our blood pressure. Okay, what happens is if patient is experiencing reflex tachycardia, bleeding or dehydration or unexpected change in blood flows occur. Okay, because of this reflex tachycardia. And then with angioedema, okay, angioedema, from the word edema, panghupong, okay, this is usually the swelling under your skin. Okay, ang pinakahadlok is if your angioedema will be what? Obstructing your airway. Okay, there is a loob. Okay, if there will be what? Obstruction in the airway, of course, pwede mag-cause na og what? Difficulty of breathing to your patient. Okay, so pag kanina mga adverse effect, okay, ma-experience in yung patient, you really have to directly bring them to the hospital and inform their doctors about the effects of these medications to your patients. Kasi nga, life-threatening na niya siya ng mga effects sa ato ang ACE inhibitors. Okay. So, your drug interactions. Okay, so our ACE inhibitors should not be what? Should not be mixed or incorporated with our probenecid. because there will be a decrease in the elimination. Okay, there will be problems with the excretion of drugs. Okay, and then later on, it will cause what? It will result to nephrotoxicity. Okay, so our ACE inhibitor should not also be what? Incorporated or mixed with our potassium supplements and diuretics, because as a result, it will cause hypercalcemia. Okay? And ACE inhibitors shouldn't be administered together with your NSAIDs. Why? Because your ACE inhibitor will not be effective anymore because it will decrease its hypotensive effect. Okay? So mawadan og effect ang imuhang anti-hypertensive medication if used with what is this? NSAIDs. Next, your NSAID should not be, okay, should not be incorporated with your antacids, because like all other medications, okay, once we take antacids, remember your antacids is going to what? Coat, okay, it will coat your intestinal tract. Okay, and then we all know that in the intestine, especially in the small intestine, it is where the absorption takes place. So kung mag-antacid ka, dili ma-absorb ang imuhang captopril o imuhang mga ACE inhibitors. So mas nawawalan siya ng effect. Dili na to makita ang effect dayon. Okay, sa ato ang mga anti-hypertensive medications. And if you are going to, if you have a maintenance of these ACE inhibitors, and then you are experiencing infection, and then your medication is tetracycline, okay? Of course, it should not be given together. Kasi nga, nawawalan ng potency ang inyong tetracycline. Kung kanina, with antacid, mawalan ng effect ang inyong anti-hypertensive medication, with your antibiotic tetracycline, ang tetracycline ang nawawalan ng effect. Okay? So, hindi na natin nakikita yung antibiotic effect ng ating tetracycline if incorporated with your ACE inhibitors. Okay? So, what are the contraindications, okay, of your ACE inhibitors? This should not be given to patients who have severe sodium depletion or sobrang baba na sodium ion level. Bakit? Because remember, your ACE inhibitors can already contribute to hyponatremia regardless kung gaano mo siya katagal ginainom. Whether di-startan pa na mo siya or dugay na mo ginainom, okay, you should not give this to patients who have what? Sodium level problems. Okay, kay mas mababa ang sodium level sa imuhang patient. Okay, mas mag-hyponatremic imong patient ana. Okay? And our ACE inhibitors shouldn't be given to our patients who are planning to get pregnant, already pregnant, and is lactating. Why? Because our ACE inhibitors is categorized as yung, if you can still remember your FDA pregnancy category, this is categorized under category D. Okay, category D, kasi nga, it shows effects, not just on the baby or in the fetus, but it also develops what? Problems to the mother, okay, to the pregnant mother, okay? And then, based on research, okay, sa research na amo ang gibuhat, okay, na ang naka-indicate lang manggod is second trimester and third trimester, dili ta maghatag og ACE inhibitors. But we go on further study, okay, dili gyud dapat siya ihatag at all, whether it is first, second, or tri. Wala jud. Okay? These ACE inhibitors should not be given at all yun. Kasi nga, it could what? It could lead to tawagan ni lower blood pressure on the mother, and then it could also cause what? Kidney failure or heart or high potassium levels in the blood of the mother kapag inatake itong ACE inhibitors while they are pregnant. Okay? So ano siya? Dili lang siya teratogenic but it has effects on the mother. Okay? So what are your nursing considerations if your patient is going to take ACE inhibitors? So number one is you have to encourage them to implement lifestyle change. Okay? Siyempre, unsa man ang key para, di ba? Like what I said in the beginning, the key role para magkaroon tayo ng normal or low blood pressure is to change our lifestyle. Whether you are a primary or a secondary hypertensive type of person. Okay, it's always lifestyle modification. Okay, and should be administered on an empty stomach because, of course, like all other medicines, mas nagiging mabilis ang disintegration and absorption of medicines once we are going to administer or take it on an empty stomach. Maubitaw na usually ang atong mga antihypertensive medications, they are given first thing in the morning. Okay? Kasi nga wala pa'y kaon empty pa, so mas paspas ang absorption, so the result is mas paspas po ang effect. Okay? If your patient is for surgery, dialysis situations which may drop the fluid volume, we have to stop the medication. Why? Okay, for example, a patient is subject for surgery. Okay, what we do, okay, based on experience, our patients who have hypertension, okay, kasi malaman mo namin yan during sa assessment pa lang, pre-op assessment. So what we do, we a day before the surgery, we are asking our patients to stop the intake of their antihypertensive medications. Why? Because patients who are subject for surgery will be receiving anesthetic drugs. And these anesthetic drugs can what? Can cause hypotension. Okay? So if your patient is taking antihypertensive drugs and taking antihypertensive drugs and then they are also receiving anesthesia, chances for the patients to have irreversible hypotension is very difficult or is very feasible. Okay? And mas lisod ba i-manage ang hypotension kaysa sa hypertension? Yes, pwede ta maghatag og fluid resuscitation. But what if your patient will have arrest because of fluid overload? So lisod pod siya, diba? So we really have to assess our patients properly, especially if they have surgery. We don't want them to have further complications sa mga medications na ginabigay natin sa kanila. Okay? And then, our ACE inhibitors should be what? Should be given we don't want to have a rapid unstable na po siya. Okay, kanang pagbaba sa ato ang blood pressure. Okay? So, once our patient is going to receive this medication, mga ACE inhibitors natin, okay, what we do usually is we really have to check their blood pressure before and after drug administration to check for the efficacy of your medication. Okay? Dili kay paghatag na to, ma'am, inom na ka ni ma'am, kay na imuhang tambal ma'am, kay hypertensive si ma'am, dili man lang nimo i-counter check. Okay? After 10 to 15 minutes, try to go back to your patient and assess your patient blood if there is changes. Okay, kung taas og samot, of course, you're going to it to your But progressive siya ng baba, that your medication is taking effect now on your patient. Below 90/70, of course, borderline naman na siya. So, dapat kabalod po ka. Okay? Mo bitaw na, di ba, kaganina sa kong giingon, katong Choppy po, choppy. Okay, asa man taman balik? Balik ta dito sa 90/70. Okay? So, your patient is already having a low blood pressure or borderline low blood pressure. Okay? Skin pa siguro maintenance na niya. Ayaw sa ninyo ha. Hold usap ninyo ang inyong anti-hypertensive medication. Kay base, the more na ninyo ihatag inyong maintenance sa inyong patient, okay, masamot na og kamubo ang iyahang blood pressure. Okay? Kaya nga sinabi ko, if there are unusualities, okay, you directly inform your attending physician. Dok, ang BP sa akong pasyente mubo na kaayo. Okay? Mubo siya like 90/70. Ihatag gihapon ako akong maintenance. Try to relay it to the doctor so that the doctor will try to assess your patient. Ya, di ito ba mali ra ang pag-check sa BP mo? Sa funda, okay, unsaon ang tamang pag-BP, dili kay magsigirag bugna. Okay? Nagsigirag pump sa inyong mga tawag ani mga bulb sa inyong sphygmomanometer pagkahuman. Di ay ito, wala di ito inadunggan na kurot cough sound. Okay, nagtagna ra di ay ito. Okay, so you have to properly check and assess your patient's blood pressure yun. Okay, kaya basi niingon ka dito sa doktor na, ladok 90/70 niya, di ay ito, dili di ito 90/70 na, buot-buot ra di ay ka. Okay? Tapusin ko lang ito siya class and then I will give you 15 minutes break. Okay? Next is avoid ambulation. Okay? Kasi nga, patients who are receiving, ACE inhibitors, tendencies is, di ba, na sila yung mga headache, na, so medyo dizzy sila. So, of course, you should guard your patients well. Okay, if they are experiencing this, kasi we don't want to have further complications or further problems. Kaya basi, gipasagdahan na nimo imong pasyente pag humaniya o tumar sa tambal, natumba imuhang pasyente, you will be liable to that. Unya, kung kamo ang nag-inom, unyang CI, unsaon nila yung CI? Diba? Unsaon yung CI? Unya, nagkatawagan nila, tawag ani kan cranial fracture, di ba, simbako palayo. Like what I said, after you give the medication, reassess your patient. Okay? Reassess not only the blood pressure but the sensorium of your patient. Ma'am, for cough and angioedema. Okay? Syempre, cough and angioedema is really unstable na po. If there is angioedema or accumulation in the airway, di ba? Paminaw ni mo medyo katul-katul, kung ano is niya si ana niya di ay to wala na later on na maglisod na og ginhawa ang imong patient because the airway is already obstructed because of the fluid accumulated in your neck brought about by your angioedema. And report for signs of dysphagia kasi nga, di ba, you will have a feeling of what? Yung metal-like taste. So, katong metal-like taste, muura po na siya, inig na atay mga bleeding, kanang mga bleeding sa bakbak. Kanang feeling na ito nga kanang malasahan na tong dugo, okay, wala ta kabalo na we already have mga dental problems mo na siya kanang mga dili na to nga mura maglasa og kanang paya oy, but that is your blood. Okay, so we have to know that kasi nga basi di ay naanay bleeding ang imong patient. Okay, so we have to be watchful with those signs. Okay, so okay, I will stop from here. Okay, it's 3:03 on my time. I will give you 15 minutes break. We will be back at 3:18. Okay, sige. You may take your break.
Recording in progress. Recording stopped. Recording in progress. Recording stop. Recording in progress. Recording stopped. Recording in progress. Recording stopped.
Shall we continue? With the nursing considerations about our ACE inhibitors. I mean, yeah, our ACE inhibitors. Now we will move to our angiotensin 2. Now we will go to your angiotensin 2 receptor antagonists. So what are these medications ba? Okay. Our angiotensin 2 receptor, as we all know, this is a potent, okay, it's a potent vasoconstrictor. So what these A2 receptor antagonists do, or A2 receptor blockers do, they are trying to, kadali lang class ha. Okay, they counteract the effect of our angiotensin 2. So they selectively bind with our angiotensin 2 receptors in the blood vessels and in our adrenal cortex. Okay, so this will help relax your veins and our arteries to lower your blood pressure and make it easier for the heart to pump blood for the body. Okay, that is what our A2 receptor blocks. Okay, so as a result of this, okay, once a patient is going to take A2 receptor antagonist or blocker, okay, they will have what? Dilated or widened veins and arteries. Kaya yan nagkababa yung kanilang blood pressure because of this A2 receptor blockers. Okay, so sure ako ang atong mga parents na ay mga ingon ani nga maintenance. Okay? Kanang mga sartan, sumuon na ni siya ang atong mga A2 receptor antagonist. Okay, mga losartan, irbesartan, candesartan, valsartan, and eprosartan. Okay, basta sartan, mauna na siya. Okay, so what are the uses of these A2 receptor blockers? Okay, they are used when our ACE inhibitors are no longer tolerated by our patients. Baga second option ang ato ang tawag ani A2 receptor blockers. Okay? What are the common side effects of this medication? Okay? Headache, your diarrhea, your dyspepsia and cramps. So more on mga GI, mga irritations. Okay, and then as a adverse effect, okay, our patients might experience angioedema, okay, edema and hyperkalemia. And these medications is what? Contraindicated for our patients who have what? Nephrodysfunction or may mga renal failures, congestive heart failures, as well as patients who are pregnant. Okay, this medication should not be given to them because this is still categorized as category D. Okay, for there's a high risk for tawag nito, fetal problems as well as maternal problems if they are going to take this A2 receptor blockers. Okay. So what are the things that you have to consider if you're going to give this medication to your patient? Okay, number one, ensure that the patient is not pregnant or she is not lactating and planning to get pregnant. Okay, because we don't want to have problems between the mom and the baby. Okay, this should be taken without regards to food. Okay, so pwede daw siya immune whether you are already eating or on an empty stomach. Okay, there will be no problems with the absorption of the medicine. Okay, monitor your patient's vital signs regularly. Okay, not only A2 receptor blockers, but even on all forms of medications. Once you administer it to your patients, make sure to recheck your patients for any signs of side effects. Okay, and make sure that your patient's serum electrolyte, most especially your potassium, is well monitored. Okay, because our ARBs, okay, ARBs mo ni ato ang abbreviation sa atong angiotensin receptor blocker. Our ARBs already decrease our potassium excretion. So, kung ganon, pwede magkaroon ng hyperkalemia ang ating patient. Okay? That's why it is important, okay, that our patient potassium level should be monitored and your patient is not taking any potassium supplements. Okay? Kasi nga, we don't want our patient to result having hyperkalemia. Okay? So, another form of medication is what we call calcium channel blockers. Kadali lang class ha. Give me 2 minutes. 2 minutes lang. Sorry lang. Okay. Our calcium channel blockers. So what these calcium channel blockers do? They prevent the movement of calcium ions in our myocardium and vascular smooth muscles. Okay? Remember that your calcium normally, okay, increases muscle contractility and peripheral resistance, especially in increasing our blood pressure. But, okay, our calcium blockers will block its function. Kaya nga naman, if there will be overproduction of our calcium in the body, what happens is your heart, especially your heart, will double its work. Okay? Mag-overload ang imuhang heart. As a result, you will have tachycardia. Okay? And then, we don't want to overwork our, because, of course, we don't want na ma-stress ang atong heart because later on, it will relate to certain disease. Okay? And then, these calcium blockers are also used, okay, for patients who have hypertension, patients who are experiencing angina or chest pain, and for patients who have atrial fibrillation. Okay, yung mga arrhythmia natin. Okay, also, our doctors is giving these calcium channel blockers for patients who have blood vessel conditions. Unsa maning mga blood vessel conditions na ginaano sa ato ang calcium blockers. These are for patients who have Raynaud's disease. Ma'am, unsa ning Raynaud's disease? This is caused by the smaller arteries that supplies the blood Okay, blood flow in the skin and narrow in response to your tawag ani kanang pag-stress ganito or bugnaw gani kaayo. Okay? So kaning Raynaud's disease, okay, this is triggered if your patient is stressed, okay? And then anxious imong patients. So as a result, there will be temporary spasm. Okay, there is temporary spasm that blocks the flow of your blood in the body. That is what you call Raynaud's disease. Okay? So, ginabigay yung mga calcium blockers doon sa yung mga na-mention ko na uses niya as well as Raynaud's disease. Okay? So, our calcium channel blockers has two major categories. So, what are these two major categories of our calcium channel blockers? We have non-dihydroxypyridines and dihydropyridines. Okay? So, ano daw itong mga non-dihydropyridines? So, these are medications that inhibits the effect of our sinoatrial and atrioventricular nodes in the heart. Okay, the SA and AV nodes of our heart. Okay, as a result, okay, our cardiac conduction and contractility is getting slower. Okay? Kasi nga, they inhibit the effect of your SA and AV node, resulting to a more slower cardiac contractility and conduction. Okay? And this allows, okay, this allows for the treatment as well of your hypertension and then the reduced oxygen demand. Okay? So, it could help what? It could help control your tachydysarrhythmias. Okay? Ito yung ating mga dihydropyridines. Okay? So, example of this which is very potent and lagi mong makita kapag sa hospital is your verapamil. Okay? We also have diltiazem. Okay? Those are the calcium channel blockers under non-dihydropyridines. Okay? Which interferes the effect of your SA and AV nodes. Okay? So ano 'yon? Pag ang SA and AV nodes ang yang i-interfere, there will be a slower, okay, slower cardiac contractility and conduction. Okay? Mas humihina yung movement or ang work ng iyong heart kapag meron tayong mga calcium channel blockers, especially if it is a non-hydropyridines type of category. Okay? What about dihydropyridines? What are these medications? These dihydropyridines, okay, ito yung mga pine-pine. Ito yung mas common natin nakikita na mga medications or maintenance din ng ating mga parents. Okay? Labaw na ning amlodipine. Okay? Kaning amlodipine, okay, or dihydropyridines, these are the therapeutic doses. Okay? These are the type of therapeutic doses that has what? Little but direct effect, okay, on your myocardium. Okay? And instead, okay, and instead it becomes a peripheral vasodilator. Okay, it is mostly useful for patients who have hypertension, patients who are also experiencing post-intracranial hemorrhage, and okay, post-intracranial hemorrhage that is what is this associated with vasospasm, and for patients who have migraines. Okay? So, ito yung mga dihydropyridines natin. Yung mga pine. Okay? So, what are the side effects of these medications? Of course, we have your headache, your dizziness, hypotension, syncope, reflex tachycardia, your constipation, AV block, bradycardia, and peripheral edema. Okay, so what will be now your nursing consideration for a patient taking calcium channel blocker? You have to regularly monitor your ECG, cardiac rate, and BP. Okay, kasi nga, we want to make sure that your patients will not have any calcium channel blocker toxicity. Okay, especially kaning ECG, kailangan din nato i-monitor sa atong patient kasi nga di ba ang iyang effect is ipa-slow down niya ang contractility sa imong heart. So now, if the contractility of your heart becomes slow, tendency is basi magkadayon-dayon magbradycardia imong patient. Okay, and then we don't want na moabot sa point na mag-relax ang iyang heart and it will be it will cause patient's death. Okay, that's why we have to really check the ECG and the cardiac rate of your patient. Okay, always have an e-card available with IV administration kasi nga chances of patients acquiring bradycardia is very high, and we don't want our patients to have what kanang irreversible bradycardia. So we have to give them our antidotes, okay, for that. And it's all in our emergency card. And later on, we will be discussing all the emergency medications that we are going to use for emergency situations. Okay? And then, for instance, your patient has peripheral edema. Peripheral, dili lang kay angioedema. Kunyari, merong lower extremity na edema imong patient. So we are going to perform mga postural drainage positioning. Okay, like elevating of your legs or your limbs that has edema. Okay, protect the drug from light and moisture because we don't want to disintegrate, okay, the potency of your medication. So proper storage is really required. Okay? You have to increase OFI and high fiber diet on your patient. Not only for patients taking calcium channel blockers, but to all patients. Okay, we have, if it's not contraindicated for them to increase their OFI, encourage your patient to have increased OFI. So what? There will be excretion of what? Excretion of those medications that they have taken. Okay, and then avoid overexertion when anginal pain is relieved. Okay, kaning mga usahay no, kaning ato ang mga elderly spot, ganing kung kinsa pa ang mas mga may edad buo pa to ragahi og ulo. Okay, imong ingnan kay na okay na sila, wala na nagsakit ilang dughan, magsige na pud og lihok-lihok kanang dili gani mahimutang. Okay, so encourage them once they are what? Stable already. Let them, encourage them to have what? Complete bed rest. Okay, ayaw po ng complete bed rest without bathroom privileges. Lahi na po na. Okay, just tell them na try to relax for some time para mas faster ang recovery sa ating mga patients. Okay, so if your patient is experiencing headache, you can advise them to give what? Or you can give them paracetamol to treat for the headache. Okay, and then unlike all other medications, our calcium channel blockers will not interfere the absorption of these medicines even if we have taken food or even meal. Okay, and what is the most important thing you have to teach them? We should not allow them to chew or to crush the medicine. Kasi nga, these calcium channel blockers are sustained release or kanang mga SR, gani nato ng mga tambal. Okay? Because these medications are intended to be dissolved inside our stomach. Okay? With the help of our gastric contents. Okay? Dili kay sa bakbak. It should be inside our stomach. Okay? So, take note of this. when taking calcium channel blockers, okay, remember VND, okay? VND, your very nice drugs, your verapamil, nifedipine, and diltiazem, okay? And the action of these calcium channel blockers is what? It decreases heart contractility, it decreases conductivity of your heart, and it decreases the demand for oxygen. Okay? Ma'am, kung mag-decrease ang demand sa oxygen, dili ba hypoxia imong patient? Dili man pod sa mawad-an na siya og oxygen. I-decrease lang natin. Okay? As a compensation to the existing problem of your patient. Okay? So the side effects of this medication, there will be a decrease in blood pressure. There is bradycardia. Kaya nga dapat monitor your patients' vital signs. May precipitate AV block. Okay? There will be headaches, abdominal discomforts, and of course peripheral edema. Okay, and then we have talked about all of the managements that you have to do with these patients. Okay. So now let's proceed to our vasodilators. So when from the root word dilator, okay, pampadako, pampadako og unsa, pampadako og ugat. Okay, ugat lang. Okay, dili na og laing pangbutang. Okay, kay mura pug ako ang mga estudyante kagahapon, pampadako og unsa, pampadako og ulo. Okay, so vasodilators, action is to relax the smooth muscles of the blood vessels, especially our arteries. Okay, this is to promote what? Increased blood flow in the brain as well as in your kidneys. Okay, so tawagan nini, doctors usually prescribe vasodilators to patients who have severe hypertension. Okay. And then, emergency situations such as kanang mga heart failure, and then kanang mga pregnancy-related problems such as your preeclampsia and eclampsia, and as well as your mga pulmonary hypertension. Okay, we are giving these vasodilators. So example of this is your hydralazine, minoxidil, diazoxide, and nitroprusside. Okay. Pinaka-common na makita ninyo sa emergency cart is this hydralazine. Okay, naagid ni always sa mga emergency cart. Okay? And then, our vasodilators, okay, work directly on the vessel walls. Okay? Ang example sa kanang mga tambal na nag-work directly yun sa ato ang vessel walls is our hydralazine and our minoxidil. Okay, maugid ni siya. So, what are the side effects of these medications? Okay, for hydralazine, okay, actually, same lang siya. Okay, naay tachycardia. That's why we are going to give patients with beta blockers. Common also is our palpitations. Kapag our patient is experiencing edema, we are giving them diuretics. Okay, headache is also tawag ani kanang common. Dizziness, GI bleeding, lupus-like and neurologic symptoms. Kung sa'yo pasabot aning lupus-like, ma'am, magka-lupus imong patient? No, but they will be experiencing some tawag ani kanang symptoms like a person who is experiencing lupus, like naa siya mga joint pain and stiffness, mga rashes sa face. Okay, feeling of kanang tiredness, kana siya, loss of appetite, common pod ang kanang mga tawag ani kanang weight loss. Okay, kasi nga syempre there is already loss of appetite. And then as a neurologic symptoms, common ang patient na maka-experience og kanang mga numbness and tingling sensations as well as kanang itchiness sa ilahang skin. And okay, these medications can what? Can lead to feeling of depression and anxiety. Alam mo, kahadlok ani nga tambal, mamboy. That's why, okay, when you are giving this kind of medication to your patient, it is really advised to monitor your patients. Not just the effect, but as well as the sensorium of your patients. Okay? So, same lang siya of effect, or I mean side effect, ang kanang hydralazine, minoxidil, and meropenicillin. But, okay, anong pinagkaiba lang nitong tatlo? Your minoxidil, okay, ang makabalugyog ka na, your patient is taking minoxidil because once a patient is taking this kind of medicine, there will be excessive hair growth on your patient. Okay? And, di ba, kung imuhang tanawon ka ng mga products that are what? Mga hair growers, labaw na ka na sa mga nangapanot, na? Unsa ang ilahang mga main component sa ilahang mga hair growers? That is minoxidil. Okay? So, minoxidil. But, okay, be careful lang po ta sa paghatag o ato ang mga minoxidil because this could precipitate chest pain. Okay? So, what are the contraindications of this medication? It is contraindicated, of course, to patients who have allergy. Kasi we don't want to have hypersensitivity reaction related to your vasodilators. Okay, it is contraindicated to pregnant and lactating mothers because they could what? Pass through our breast milk barrier. Okay, so pwede siya mag-cause of problem sa ating mga babies. Okay, and pwede po siya magkaroon of problem, okay, or cause of problem sa atong moms. Okay, pwede magkaroon kidney failure ang inyong mom. Okay, so that's why that we really don't encourage these medications to be taken to our patients who are pregnant and lactating. Okay, cerebral insufficiency. Okay, kasi nga, our patients who have cerebral insufficiency might get worse. Okay, might have worsened their situation once they are taking vasodilators. Kasi nga, di ba, ang function sa ato ang vasodilator is to lower the blood pressure. And then if there is already cerebral insufficiency, kulang na ang blood supply sa utak, imuha pang paimnon og vasodilator, pwede mag-comatose imuhang patient. Okay? So, it should not be given, okay? I mean, the drug interactions, okay, our vasodilators, if we are going to give it, okay, like what I have said kanina, we are going to give it to our patients and we will incorporate it with another type of antihypertensive medication, we will be resulting into an additive effect, okay? And we know that if it is an additive effect, okay, we will be expecting a faster and a more potent type of medicine. But okay, this kind of tawag-ani ka ng combination of drugs should not be applicable to all. Kasi nga, we have to consider also the present condition of your patient. Kung wala ba silang mga kidney problems, liver problems, which is essential for the metabolism and excretion of drugs. Okay? So, what are the nursing considerations for patients taking vasodilators? Remember the mnemonics dilator. D stands for directly act on vascular smooth muscles. Yun ang effect ng ating vasodilators. It increases renal and cerebral flow, okay, because it will dilate our vessels. L, lupus-like reaction. So the patient will be experiencing some lupus-like symptoms, fever, facial rash, joint splenomegaly, and muscle and joint pains. Assess your patient for signs of peripheral edemas, and if it happens, elevation is one of the key things that you have to perform to your patient. Take it with food, okay? There's no problem, okay? If you're going to take this with food, because the absorption will not interfere even with there is food. Your other side effects include your headache, your dizziness, your anorexia, increased cardiac and decreases blood pressure. That is still things that you have to consider. And of course, you check your patient's blood pressure, because if your patient's blood pressure is already low, okay, we should not give vasodilators kay magsamot og ka-hypotensive ang imong patient. Okay? So do you have any questions? Do you have any questions, clarifications, violent reaction? Oy, noon sila to. Oh, ano na? Meron? Wala? Ma'am, wala na din lang mo istorya ma'am kay kanang kapoy na ma'am. Okay, if you don't have any questions, okay, I will be posting the video, okay, on Quipper, and then of course expect a quiz, okay, on our next meeting. And actually, before I forget, I want you to have an assignment. Okay, this is still part of your another kind of medications for antihypertensive. These are sympatholytic medications. So I will send on the GC, okay, the format as to how you are going to do it. Ano siya pakita sa Thursday po? Ano siya pakita sa Thursday? Hoy, Bing, unsay pakita sa Thursday? Unsa kung pakita?
Wala ma'am, gimingaw lang minimum ma'am.
Ah, serang frag mura jud.
Ayun na sa front ma'am.
Wa man gani ka nang open cam kahon. Mingaw si mong mata, dusla
Tagko na kayo ko mo.
Ansa?
Wala ma'am.
Okay, sige. I will give you the guidelines. Okay, I will give you the guidelines on how you are going to make the assignment. Okay, about sympatholytics, and then I will also send the G form, G drive. Okay, where you will put your assignment, and then next meeting we will have the quiz. I will be calling one of you, okay, to share about their assignments. Okay, and then the deadline of this will be on Friday at 5 p.m. Okay, dali raman na siya kay sympatholytics lang. Okay,
Karon na week ma'am.
ha?
Karon na week ma'am.
Oh, syempre lahi po kung next week no.
Agoy.
Oo, karon na Friday. Karong Friday ang ato ang deadline sa assignment.
Dili siya may
and then
smoke, ma'am.
ha?
Dili siya may smoke ma'am kay andang pa pod mi sa mong case presentation ma'am ba. Please ma'am.
Sige, ano na lang. Monday na lang.
Monday, sige.
Oh, Monday at 5 p.m. Okay, Monday at 5 p.m. will be the deadline of the assignment. Okay, don't forget that our quiz will be on Tuesday. Okay. Samahan mo muna si Tutoy mo lang na. Ano yun? Ang inyuhang karon pa na ko ipas-control. Okay? Karon pa na ko ipas-control ang exam. Duha ka pharma o
Dili ko siya sa pharma.
oo.
Unahon sa nako
Ang anatomy.
kung sa anatomy na lecture.
Oh, lecture nito.
Lab.
Uman ko sa lab, lecture na lang. Si Sir Alden. Kagahapon ko lang nakuha, sabay aning sa pharma. Kay di man ako ang nag-proctor. So, wala siya na, Naksama ka doon, kay Kikawin.
Pwede butang sa dalo na lang.
O, sige. Dalahin mo na lang yung envelope. Tapos tingnan mo paano. Sorry lang, class, no, kay interrupt. Grabe ka, ayo ka, ano. When po malaman ang grade sa exam, kung mas cantron siya karon, okay, hopefully by next week, okay, I can have your, your grades. But if not, next week gihapon. Kapag itaan na kung paagi, unsaon ako siya pagpa-scantron. Okay? Kay gahapon lang yun nakuha ang inyong scantron. Okay? Kasi nga, di ba, dili ako ang proctor ninyo. So, mo na siya. Okay? And once I have already the scantron or the result of your long exams, makompute na nako ang inyong prelim grade. Okay? So, the assignment that I gave you today is the first assignment for the midterms. Okay? So, katong mga wala nagpasag assignment, expect that it is 50 on your class standing. Okay? So, without further ado, can I ask Bing, please lead our closing prayer.
Okay, ma'am. Father, the Son, the Holy Spirit, Lord, thank you for this day, Lord. The Lord na. Mapasar na naman yung karoon na midterm, Lord. Just name pray, amen.
Amen. Okay. Once again, class, thank you so much for your cooperation. Thank you for the participation. Okay, and I'll see you all by next week. Okay, good luck on your classes, class.
Thank you, ma'am. Bye-bye.
Thank you, ma'am.
Thank you po.
Thank you, ma'am.